Everybody, welcome back to Drug Talk. As always, I'm your host, Garrett Campbell. In today's video, we're going to be discussing a medication known as Bromocriptine. Its brand name is Parlodel. And before I talk about the medication itself, just keep in mind that this channel is for information purposes only and not to be used as a source for recommendations for your personal health care. Now, during this presentation, we'll discuss the mechanism of action or how this medication works, indications or reasons we would prescribe this medication to a patient, followed by contraindications or reasons we would not be able to prescribe Bromocriptine. We'll then touch on examples of dosing and finish it off with side effects with percentages. I've put together some slides to go over this information. Let's jump right into it. So the first thing to discuss here would be the mechanism of action or how this medication works. So bromocriptine is a sympatholytic D2 receptor agonist that reduces fasting and postprandial hyperglycemia throughout the meals of the day. It also improves insulin sensitivity and glucose disposal. In terms of indications or reasons to prescribe this medication to a patient, well, we may see bromocriptine prescribed in the treatment of Parkinson's disease or a prolactinoma, as well as type 2 diabetes mellitus or hyperprolactinemia. With respect to contraindications or reasons we would not be able to prescribe bromocriptine, well, first off, we wouldn't give this medication to a patient who had a hypersensitivity to bromocriptine or to any other component of the formulation. This medication would also not be used in lactating patients, as well as syncopal migraines or uncontrolled hypertension. Now for an example of dosing with bromocriptine. So in the treatment of Parkinson's disease, we may see an initial dose of 1.25 milligrams orally twice daily. The patient would then increase by 2.5 milligrams daily every 14 to 28 days. The maintenance range would be 2.5 to 40 milligrams per day, and the maximum dose would be 100 milligrams per day. In the treatment of type 2 diabetes mellitus, we may see an initial dose of 0.8 milligrams orally once daily with food taken within 2 hours of waking. For titration, we would increase by 0.8 milligrams per week until the maximal tolerated dose is reached. The usual maintenance would be 1.6 to 4.8 milligrams once daily. As with all medications, there are some side effects or adverse reactions that patients may experience while using bromocriptine, so we'll go over some of those here now. 3 to 14% of patients may experience constipation, while 3 to 8% may experience diarrhea. Indigestion seems to happen 4 to 7.5% of the time, and nausea 18 to 49% of the time. Vomiting comes in at a rate of 2 to 8%, and asthenia or abnormal weakness comes in at 12.5 to 19% of the time. 2 to 17% of patients may experience dizziness, and 2 to 19% may experience a headache. Rhinitis may occur in 10.5 to 13% of patients, and fatigue in 7 to 14%. The more serious side effects would be hypotension or low blood pressure, syncope or fainting, a gastrointestinal ulcer, or hallucinations. Alright everybody, that's all we're going to talk about today with bromocriptine or Parlodel. As always, I'm very thankful you took the time to come by and watch one of my videos. If you found the information valuable and you'd like to help grow this channel, remember you can like the videos, share the videos, or most importantly, subscribe to the YouTube channel. There's also some links in the description you can check out as well. That's it for today. Take care.